When is surgery indicated for acoustic neuromas?
So surgery is one of three different mechanisms to treat and or follow acoustic neuromas. For this particular question, we'll talk specifically about surgery. Surgery is indicated for acoustic neuromas under certain circumstances, and these are not very rigid guidelines, but they're scenarios where we commonly think of where surgery is the preferred treatment. So the first situation would be where the tumor is large, and large is always a relative term. It depends on the shape of the tumor, but once a tumor becomes larger than about 3 centimeters or about 1.5 inches in diameter, we start usually thinking of surgery as the best treatment option. And that is because these larger tumors are typically associated with mass effect, and mass effect is pressure on the brain as a result of the size of the tumor. So if the tumor is large, watching the tumor doesn't really accomplish anything because the pressure is still there and the tumor can grow. And if the tumor is large, radiation can be potentially more challenging because radiating a large tumor can be associated with some episodes of swelling as a result of the radiation. So when the tumor is large, we start considering surgery as the better treatment option. In addition, there are certain symptoms that if a patient were to manifest, we start favoring surgery. And there are several of these symptoms that I like to think about. The first is the patient having facial pain and numbness. If they are, that means there's compression of the trigeminal nerve with the tumor, and the really only way to alleviate that symptom is with surgical decompression or removal of the tumor to take the pressure off of that nerve. If a patient is presenting with head pressure and headaches, that usually means surgery is the best option because, again, you're removing the mass from the inside the skull and therefore reducing the pressure in the brain. Some patients have balance issues where they're falling as a result of a large tumor pushing on the cerebellum. And in those cases, then removing the tumor and getting a decompression is potentially the better way to go. So we've talked about size and we talked about symptoms. What other scenarios would we favor surgery? Surgery is the only treatment that delivers a pathology report for the patient. So if there is some question or concern that the type of tumor we're looking at or dealing with is not an acoustic neuroma, or if the patient just simply wants peace of mind with 100% certainty that their tumor was a benign acoustic neuroma, then getting tissue for pathology is typically the only possible with surgery. And then the last topic that I wanted to talk about is if the tumor appears to be behaving in a way that raises a question of another diagnosis. So if the tumor is growing much more rapidly than we would expect for acoustic neuroma, then we need to really consider surgery to make a diagnosis because maybe we're not dealing with an acoustic neuroma.